Thank you very much for the introduction. It is a great privilege to be here, and in all my humbleness representing the Netherlands, I want to share with you some practices, so we can call them best practices from the Netherlands, but also our engagement with India on this particular topic, especially sustainability in healthcare. Now, in the coming more or less 15 minutes, this is what I would like to talk about with you. A short introduction giving you a little bit of context, then some examples of green hospitals, the way we use them in the Netherlands, always putting a focus on accessible, affordable, safe and sustainable healthcare, and of course of quality for all citizens in the Netherlands, exactly the same quality. And then a little bit about India and the Netherlands and some takeaway messages to finalize. Now I would like to warn you, I'm going to do this at the speed of light, so fasten your seatbelts, here we go. As rightly said in the introduction, the climate crisis is also a health crisis. And within the health system, we are even confronted with what we call a health paradox. Care cures patients, but also creates patients. We call that the health paradox, and I will talk a little bit about this in a moment. At the same time, as rightly said by the previous speaker, this also creates the opportunity for a lot of green innovations. So it's also about new business opportunities. So on the emissions, the relationship between the healthcare sector and the environment, what we did in the Netherlands, we created a footprint, a national footprint of our entire healthcare sector. And what did we discover? We discovered that the healthcare sector in the Netherlands is responsible for 7% of all carbon emissions in our country. That's the same as the air traffic sector. Now, in the national footprint that we made of our healthcare sector, this is what you see. 80% comes from the energy of buildings, combined with medication and transport movements together make 80% of this 7%. This gives you a good focus on where to act upon to have impact, especially, of course, energy of medical buildings. I will talk about that in a moment when I show some examples of hospitals. At the same time, we have seen, thanks to this green footprint exercise, that 13% of all natural resources that are being depleted in the Netherlands are being depleted by the healthcare sector. And 4% of all waste generated in the Netherlands is generated by the healthcare sector. Now, to give some idea, because images say more than a PowerPoint slide, I want to share with you a short video about a woman, a graphic artist, who underwent herself a breast surgery. And she made a short video about how much waste was generated by her surgery. Is there another way? Is there a way, besides, I know this person very well, Maria, She used to be a nurse before she became a graphic artist, and now she was confronted herself with surgery, and it gave her the awareness how much waste is being generated by such surgery. She was very happy with what she got. She got a new breast. She was super happy and very thankful to the healthcare sector, right? And at the same time, she said, hey, is there another way? Is there another way to have the same accessible, affordable, safe, sustainable, and quality care as I received, but maybe with a lower footprint? Now, this is what we're doing this other way, at least how we are dealing with it in the Netherlands, and what I would share with you is what we call the Green Deal for Sustainable Healthcare. This is an agreement with partners from the public sector and the private sector, so PPP by excellence in a certain way, where public and private partners agree on specific targets to be achieved by a specific time frame. And this is what it looks like. We started with this in 2015, when our first innovation was in fact an environmental thermometer for the healthcare sector. And then in 2018, we had our second version, our Green Deal 2.0, where specific targets of a reduction of 49% of CO2 emissions by 2030, which we increased to 55% of carbon emissions in the healthcare sector by 2030. But also ambitions to stimulate circularity, remove medicinal residues from water, and also very important, of course, to foster a healthy living and workplace. And now in 2022, so more recently, we have arrived at the version 3.0 of our Green Deal Sustainable Healthcare for a Healthy Future. And the two elements that are new in this version 3.0 are, first of all, also the healthy living, so more about promotion of a healthy lifestyle. So that's about prevention, in fact. And you see the healthy, varied, more plant-based and sustainable diet. I think for this, India is really very much an example to us, and I will get back to that in a certain moment. The second point that has been added in our version 3.0 is about education. In all our healthcare study programs, sustainable healthcare will be embedded in the period to come under this version 3.0. And I think that's very important to make our healthcare workers of the future aware in their education process about the importance of sustainable healthcare. Now, who are the players in this Green Deal Sustainable Healthcare? There are now more than 400 organizations that have joined the Green Deal Sustainable Healthcare. So there are different ministries, but also the financial sector, and we have some representatives of the financial sector here with us, but also the young healthcare professionals and companies. Various companies that are also active in India have signed up to this Green Deal Sustainable Healthcare, and we'll give some examples in a moment. And there are various examples of supported initiatives by my ministry, the Ministry of Health in the Netherlands, and I would like to take you through some of these examples right now. Of course, we all saw with COVID how much waste is being generated in the intensive care unit, right? We all saw the pictures in the social media and everywhere. They were going very viral. One of our biggest hospitals, the Erasmus Medical Care Center, decided we are going to make a 100% circular intensive care unit, which is also important if you see that only in their hospital, for the production of medicines and plastic, they require 4 million liters of water. Imagine, previous speaker talked also about this topic. Other examples, or here you see what this hospital has done. It's maybe not so clear here, but they made a complete footprint of their hospital so that they know exactly what comes from scope 1, scope 2, and scope 3 emissions in their own hospital. And what Dr. Biebeck exactly talked about, the importance of PPPs, they also created this initiative of the SR's evidence-based strategies to create circular hospitals, where all these partners, both the government, companies, knowledge institutes, various of which are also active in partnerships with India, are active in a consortium with the support of our government. And now this example is one that I like very much. We set up, with the support of my Ministry of Health, a national network for green operating rooms. I don't know how it is in India because I have only been here for 8 weeks in India, I'm here to stay for 4 years, so I have a lot to learn still. But I know that in the Netherlands, on average, an operating room takes about 6% of the service of a hospital, whereas it is responsible for up to 60% of the carbon emissions in a hospital. So that gives you, again, the right focus if you want to have an impact on this issue in making your hospital more environmentally friendly, where you should focus on. And especially, as there are a lot of energy experts in this room, on the energy use within your operating room, especially for air treatment, which is a very high energy consumer, which is normal because it's super important, of course, but there are ways. The question again, is there another way? Yes, there is another way, and there are various technologies indeed that are being developed or that have been developed already. I will not go into detail, but I'm very happy to give you, also to share with you these national guidelines of sustainability that have been developed by this network. The same is for green labs. Laboratories are high consumers in materials and energy. So it's very important also to address this in labs. And there we introduce the LEAF principle, the Laboratory Efficiency Assessment Framework, to make sure that there is a lower impact on the environment of laboratories. Now let us get into hospitals themselves. One of the oldest hospitals in the Netherlands is the Reinier de Graaf Hospital in the city of Delft. And what is super interesting is that they transfer residual heating to 351 apartments very close to the hospital and to commercial spaces, 4 commercial spaces around the hospital. That creates a saving of 290,000 kilograms in CO2. They set up a 15-year partnership with the company Philips. I guess you all know Philips. And for that, in Europe, Philips has set up sustainability criteria for purchasing medical equipment. So procurement of equipment is a very important issue, of course. I will not get into details about this. Let us go to a next example where I talked about the importance of prevention. Prevention is, of course, very much on green and healthy environment, as the previous speaker addressed as well. And our National Institute for Public Health and Environment is also very much engaging with partners in India also for this topic. Sustainable food is, of course, extremely important for prevention and for having a healthy lifestyle. And as I said, India is a very interesting example to follow with a climate-friendly diet as published here. So getting back to technologies, there's a lot of, as I said, one of the targets in our Green Deal is dealing with medicinal residues in surface water. Here we have one specific technology, CT scan urine bags, that exactly prevents contrast fluids to arrive in surface water. In the Netherlands, we have 30 tons of contrast fluid water arriving in surface water, and this technology exactly prevents that from happening so that you can keep clean and safe environments around you. Here's another example. It's the first full electric hospital in the Netherlands. They have various energy innovations that I have installed in their hospital. And you might tell me, yes, but Nico, this might be a lot more expensive, right, to build these hospitals? Yes, and you know how much? 1.2%. 1.2% more expensive, and they're aiming at energy neutrality. So imagine if they achieve energy neutrality, how much money this hospital is going to save. In addition, it has been designed in such a way that it looks more like a health center and not a classical hospital dealing with diseases. Another technology is dealing or stopping with emissions from anesthetic gases. Anesthetic gases are high polluters. And again, the question, is there another way? Yes, there is another way. They did this, and the saving they have been able to achieve for the moment is 220,000 kilograms CO2 per year, which is the equivalent of 1.2 kilometers by car. that for a country like the Netherlands, which is a little bit smaller than India, is quite a lot of saving, right? With just one technology. And of course, we are a very aging society, a lot more than you are. So it's also important that our long-term care, elderly care institutes also adapt to this. So I don't know what you think, but I wouldn't mind to age in such an environment, right? And again, also with sustainable food. In fact, I already booked a room, but don't tell anybody. But let me get to the importance also of involving the care professional all the way. We used to have the nomination of the Sustainable Care Professional of the Year, but now in practically all hospitals you will have green teams dealing, for instance, with sustainable procurement, not only of medical equipment, but also of everything that is being purchased in a hospital, and also the Green Leadership Award. Now, all of course, this is happening in the Netherlands, but also, of course, we are very much active in the international sphere, as you see on this slide, also engaging with India. And you saw, probably you know, that in the month of May, the end of May this year, the resolution from the WHO on climate change and health has been adopted by all member states. And this was the initiative of the Netherlands together with Peru. And we very quickly got the support from Fiji, Barbados, Kenya, the UK, and finally it was adopted by all member states of the WHO, so also India. And we're now working on implementing this. How about India? As I say, I've only been here for 8 weeks now, but I've been seeing that there is so much going on in India on this topic, be it from governmental level, from the private sector, from research institutes, from foundations. And I truly believe that India has everything it takes to lead by example in a very vibrant healthcare sector and a booming healthcare sector. A good example of the application of solar energy. And how about us and India? Here you see that on the 30th of September, I participated at the Hospital Tech in Mumbai, exactly on the topic that we are discussing today. And also in September, so last month, we signed an MOU on renewable energy. And of course, we hope that a part of this renewable energy sources will also be applied in the healthcare sector. Now, takeaway message number one, previous speaker referred to the COP29. And just yesterday, these publications were made available. Going up to COP29 in two weeks' time. And I think this is really a great opportunity as well. And what is important, again, about evidence-based, that there are various innovations that can already be applied, where in fact there is a benefit of $4 for each dollar invested in proven solutions. So this is what we can already do. Takeaway message number 2 is that together we can solve this health paradox that I started with. Because if we replace I by we, then even illness becomes wellness. Thank you very much for your attention.
And ladies and gentlemen, please give him a big round of applause. Thank you, sir. It's a pleasure.